I was motivated pretty early on to go into medicine. I knew that I really wanted to help people. And what I wish my patients knew when they're coming into that first appointment after being diagnosed with MS is that I'm on their team. I'm here to help them understand this disease. Hi, I'm Dr. Jacqueline Nicholas, and I'm a neuroimmunologist, and one of the conditions that I treat is multiple sclerosis. Some of the top questions that my patients ask me about disease-modifying therapies or DMTs are, will this treatment help me feel better? In general, they're really about preserving the brain and spinal cord to prevent future problems caused by damage over time from MS. We do know that with multiple sclerosis, disease-modifying therapies help to allow somebody to maintain their memory and thinking and their physical function longer and for a longer term. Another common question that my patients will ask me is the treatment affordable? And what I tell them is, let's focus on what is going to be best for your MS. Let's look and see what resources are available. For most any patient, whether they have insurance or not, we can often find resources to fund that treatment. And so I always tell people, please don't just stop coming. If you lose your insurance or something happens, we can always find a way to help you get a treatment for MS. The next most common question is, what are we going to do about all these symptoms that I have? And we talk a lot about symptom management, the most common being fatigue, sometimes bladder difficulties, numbness, pain, spasticity, you name it. Fatigue is the most common symptom in MS. Over 80% of patients with MS report having fatigue. And really the best way to treat this symptom or to address it is to understand somebody's lifestyle and to see if their sleep is okay, to see if they're taking medicine that might be making them more tired, to make sure that they aren't having other problems that could make their fatigue worse, like mood problems such as depression or anxiety, and also seeing if they're incorporating any exercise. So we ask about all of those things and then really try to formulate a good plan of how to boost energy for each individual. The face of MS now is very, very different than the face of MS 5 years ago, 10 years ago. There are so many people throughout healthcare and science that have dedicated their lives to better the lives of people with MS and to ultimately someday find a cure for this disease. So the future is very, very bright, and so you should have a lot of hope going forward.